Well, hello, everybody. I am Peter Konetsky, and I am here today with Dr. Jeanne Mandelblatt, who was the 2020 ASPO Joseph Efraimini Jr. Distinguished Achievement Award winner. And we're going to have a little bit of question and answer right now. So I'd want to start off the interview here by asking, so you received your MD, and then after you received your degree, you entered a residency program in social medicine. And just wanted to hear about what was your motivation for choosing a program in social medicine, and how did you envision your future at that point in your life?
Well, as a young physician, I believe then, as I believe now, that health inequities can only be addressed by addressing the social and political context within which people live. The residency program in social medicine trained us to be advocates for the health of our communities and our patients. And that has been a guiding principle for me. I went to work as a family physician on the front lines in Harlem and East Harlem. I didn't know then, when I started the journey, what the power of research would be for advocacy.
Yeah, great. And we first met while you were on faculty at Memorial Sloan Kettering Cancer Center. And at that time, I was enrolled in my Master's in Public Health program. And during that time, during our overlap at Memorial, what was your research focus?
So after my experience on the front lines working in Harlem and also in the public hospital system advocating for change, I had recognized the burden of cancer in certain populations. And I'd written my first career development award. It was called Old, Poor, and Black: Combating Cancer Triple Jeopardy. And it focused on breast and cervical cancer. And at that time, cervical cancer, I was thinking, was related to aging and reduced immune responses. And it was around the time that HPV was being recognized as a risk factor. So together, you got your master's in public health and PhD, and I completed my PhD work in looking at cervical cancer in the Harlem community.
Those were very good times. And let's fast forward a couple of years. And what was your first introduction to simulation modeling, and how did you become involved with SysMed?
So, in advocating for cancer care in older women, I began to wonder, with cervical cancer as an example, it's a slow growing cancer. And would older women who had a lot of other illnesses live long enough to develop the cervical cancer? And would we be doing harm versus helping them in doing pap smear screening? And so, with my colleagues at Mount Sinai, we did our first model of evaluating cost effectiveness of cervical cancer screening. That was an Excel spreadsheet using data from my first study, which was the databases archived on index cards. And we did that. And at that time, Congress was interested in expanding Medicare coverage to include preventive services, including pap smear screening. So with my longtime friend and colleague, Clyde Schechter, and others, we did a simulation model of cervical cancer screening for older women under the Medicare program. And that showed that it was very inexpensive per year of life saved. And for older Black women who had higher rates of cervical cancer, it actually saved money as well as saved lives. And that was the basis for Medicare enacting its first preventive service in having pap smear screening besides immunizations. And Clyde and I went on to expand that work into breast cancer, and were funded in SysNet in the year 2000. And we have been modeling in SysNet since.
So with your focus on cancer in seniors, tell me a little bit about ageist bias in cancer treatment and therapies.
So I was very interested in this because I had started out being interested in both age and race biases, and I had gotten my training in geriatrics by then. A lot of my patients would say, "Well, why do you care about me? I'm old. I don't matter." And I was just shocked, and they felt that in the healthcare system that it didn't really matter. They were old, their symptoms were discounted, and many of my patients were very active, vigorous, fit, and would likely benefit from both cancer screening and cancer treatment. And so I started to look into age bias in cancer treatment and try to understand better what women wanted and what they could tolerate.
So, looking at your CV, you have over 250 publications. So which one do you think is the most impactful piece of work, piece of research that you've published?
Hmm. Well, in terms of numbers of citations, the body of work I've done with CISNET on breast cancer screening is the most often cited. A paper with Don Berry and the CISNET team is my most cited and the most cited CISNET paper. But I hope my body of research on cancer and aging will be more impactful in the long run in helping determine screening and treatment care for older individuals. And I'm most proud of all of these papers of a paper I wrote was my second paper ever, which was in JAMA in 1986. And it was handwritten, 13 handwritten drafts, and later typed and submitted. And that was looking at gynecological care for older women, another look at pap smear screening. But of all of the papers, I'm most proud of the papers I've done with my mentees over the years.
I'm glad to hear that. Really nice. So your research career has spanned the full spectrum of translational research, including some collaborative studies that are anchored in animal models, mouse models. So how did incorporating bench science into your research really help enhance what you're doing and your knowledge base?
Well, I think this has been a fascinating time to have a career that has spanned such rapid explosion in knowledge about basic biology. And by being able to observe something in the population and then say, well, I wonder why that is, what's the mechanism? And to be able to partner with a basic scientist to go into a lab model helps accelerate knowledge and move forward faster and then go back again to the human population. We've been doing some studies on cognitive aging and the role of the ApoE gene in cognitive aging after cancer and cancer-related treatment. And I was fortunate enough to be able to collaborate with my colleague, Dr. Bill Rebick, who's an Alzheimer's researcher who had an ApoE model, ApoE mouse model. And I said, have you ever thought about giving cancer chemotherapy to these mice? He said no, but he said, okay, I'll try that. And we've made some really nice discoveries. And in looking at the brains of the mice, we can understand the mechanisms. And we are working on a preliminary phase 2 study of it's a RAGE inhibitor to prevent cognitive decline. And in our mouse model, the pre-treatment with the RAGE inhibition was able to totally avoid the cognitive declines we had seen in the ApoE4 mice. So we're going to move forward now to go back into humans to do a trial and see how this works in women. So I think it's a wonderful circle of translation from the population to the lab and back.
Absolutely. So not only have you put research and science, to the forefront of your career, but you've also been very active in advocacy throughout, your life. So can you tell me some about your fundraising activities and advocacy?
Yes, I mean, going back to my roots in social medicine, I really believe in a boots on the ground approach to advocacy, and so I started a team that was did walking to raise funds for breast cancer, originally with the Avon Walk for Breast Cancer. Where we had raised over $1.5 million that was donated to Lombardi Cancer Center for research and for services in developing the Capital Breast Care Center, which is a community-based screening organization. And when Avon stopped walking, we started the Walking Warriors Battling Breast Cancer. It's a new nonprofit, and we'll be having our fourth annual walk. It'll be virtual this year. And also, you and others know that I knit incessantly through all of my meetings, and my family had enough things to wear that I had knit. So I started something called Knit One, Cure One. And I sell the wearable fiber art to raise funds and donate that towards breast cancer research.
It wasn't only in your meetings, but it was in your work environment too.
Mhm. Yeah, if I'm sitting, I'm knitting.
Absolutely.
Mhm.
Okay, so for the, our last question here, my last question to you is, how would you explain the importance of your work in the field to a young person who is also considering work in the, in a similar field for their career?
Well, I think I would really say to follow your passions, that you can make a difference. And the secret, I think, of my success is a dogged persistence. I was called tenacious by many, and I think that with that persistence, it's a fun career. It's a wonderful way to be creative, think about a real world problem. Gee, I wonder why that is, and what can I do about it? And you can make a difference.
Well, thank you for your time, Jeanne, and it was a real pleasure to be able to speak with you and to have you receive this as my first, one of my very first mentors. It's really great, and I'm very proud to be part of this.
I'd like to dedicate this award to my mother, Gladys Glassman, who taught me that you can do anything that you want to do. I would also like to thank all of my wonderful colleagues over the years in the Lombardi Georgetown Cancer Prevention and Control Program. I'd like to thank all of my mentees over the years, including Dr. Konetsky. And I'd like to thank the Walking Warriors Battling Breast Cancer for walking all the miles with me. And I'd like to thank my family for being there along the journey with me and making it all worthwhile.